So natural killer cells have been known now almost for 50 years, initially described by the Karolinska group in Sweden, has become a part of our treatment armamentarium. And initially, NK cells, these are the innate immunity elements, which are the first immune defense mechanisms to protect us from viral infections and also against the cancer cells. They have the cytotoxicity capacity. Initially, these cells have been used as a in vivo application because it is possible to expand these cells in vitro and infuse to the patients. But the problem with NK cells is that their lifespan is only between 7 to 10 days. So you need to boost these cells. But there is a great advantage with NK cells because it doesn't require the HLA matching. So this is a perfect off-the-shelf cellular therapy source. And NK cells can be obtained from peripheral blood, from adults, and also from cord blood. And we know that worldwide there are more than a million cord blood stored, and this is a perfect source. Earlier we have presented at congresses the difference between cord blood NK cells and autologous cord NK cells as in the immunocytotoxicity against myeloma cells. And today at the Donald Thomas lecture, Katie Rezvani gave a extensive and very brilliant presentation on the history of NK cells and how it has evolved through the years from the basic expansion to the CAR NK constructs, and the different constructs can be applicable to not only hematological cancers but also solid tumors. This is an amazing adventure. It shows promise by virtue of having the potential of off-the-shelf constructs. And what is even more important, I think, is CAR constructs can be complicated, maybe not applicable for many countries and institutions, but there are also now NK cell enhancing molecules that can be used. And at this Congress at ASH, there are abstracts on the AFM molecule which is being used, and so NK cells being complex with this molecule and then being introduced following the infusion seems to be highly effective among multiply treated and very refractory patients. So this is a time to be very enthusiastic and very optimistic about the cellular therapy, not encompassing only T cells but also NK cells.